This is Sky News, Australia's news channel.
Good evening, welcome to the program. Tonight we're doing something a little bit different, putting politics to one side and exploring an issue that's, well, a growing challenge for a growing number of Australian families. Between now and 2050, the number of people suffering dementia is expected to increase fourfold to about 1 million Australians. Tonight we're looking at what it's like to live with dementia, what it's like to care for someone with dementia. Do we have enough funding? Do we have the right sort of care in this country? Joining us this evening, Buttrose, a well-known face to all, but in this capacity tonight as President of Alzheimer's Australia. Professor Henry Brodaty is the Professor of Ageing and Mental Health at the University of New South Wales, also the Director of Aged Care Psychiatry and the Head of the Memory Disorders Clinic at the Prince of Wales Hospital. Ron Sinclair is the Chair of the Consumer Dementia Research Network, and Ron also cared for his wife Diana until she passed away in 2006. And Stephen Judd is the Chief Executive of the aged care provider HammondCare. Welcome to you all. Let's start with what dementia actually is. We might ask you, Henry, to explain what is dementia. It's a bit of an umbrella term.
It's an umbrella term. There are many causes, over 100 causes. Alzheimer's is the most common of those causes. And what it means is it's a loss of memory, a loss of other thinking functions that interferes with day-to-day life and represents a decline for that person from where they were before.
So, but it can vary in its severity, obviously.
They all start off mild, generally, and progress in different ways. And it can progress to the stage where a person is totally dependent for care in a nursing home, or it can be very mild and a person's functioning pretty normally in the community with support. And
Alzheimer's in particular, Ida, this is the main group that we're talking about here. How would you describe what it is?
For the person who has it, I think it brings social isolation and a loss of the friends. People in the community really don't know how to react to people with Alzheimer's, with dementia. They don't know how to cope with the behaviour. And I often say to people, you have to remember that there's a person there still.
It leaves that person feeling extremely isolated. Very
isolated, and the carer as well, because caring is a 24/7 job, and the carer also loses social contact with people, so she feels very isolated as well. Ron would probably agree with that.
Just tell us firstly your experience, because I know you've got sadly a lot of experience with it.
Yes, in my wife's case, she started developing just, I would have to say, unusual behaviours. Things like opening drawers and never closing them, walking through the house, turning on lights, never turning them off, although that's a typical woman thing.
I beg your pardon.
Brave man, huh?
But just unusual behaviours that was atypical.
But you wouldn't have suspected anything at that point, surely?
We didn't, no, but we did have a family history, and we had done some family history work.
And you knew that at the time?
Not then. We knew that there was some dementia in the family, and that was all we really knew. And it progressed over a 10-year period where we tried to get a diagnosis.
And we should point out here that your wife was quite young at the time.
She was in her mid-40s when this started. And she wasn't diagnosed until she was, I think, 56, before she got a diagnosis. People just wouldn't accept.
It took 10 years.
It did, yes.
Is that Henry, is that common?
The typical time from first symptoms to diagnosis is 2 to 3 years. But in younger people, because people always think it's an old person's disease, they don't suspect it. There's a longer time. 10 years is extraordinarily long.
But are you seeing more younger people being diagnosed?
The latest figures from the Health and Welfare Institute put the number of people with younger onset dementia at 23,000, and that was a lot more than we'd been saying. We'd had the figure at 16.
Is that just because there's more awareness, or is this something going on?
I think there is more awareness. But whilst there's that 16,000 or 23,000 people who have younger onset dementia, I think the thing to say is that the face of dementia is overwhelmingly older. I mean, I think one of the challenges for people who have younger onset dementia is all of the relationships that they have. Their partner or their spouse might still be going to work. They might still have kids at school. Those are the things that compound it and perhaps make the problem far more challenging for them because they're in that workplace or their partner's in the workplace.
And the care services are tailored, and we'll get into this a little later,
right,
but tailored to an older
demographic. Absolutely they are. But I think it's important to say, David, that the overwhelming number of people who have dementia are older, not younger.
The average age of onset's around about 80.
Right.
And the reason we're having this epidemic is because we're growing older. Our population is now 13% of them are aged over 65. That's going to double in the next 30 years.
Which is why we're going to see these numbers, this fourfold increase.
And population over 80 is going to quadruple from 2% to 8%.
Let's get back to what some of the signs are. And, you know, Ron, you were talking about your wife's experience. Is that typical?
Typically, the first signs are memory loss, but personality change, often very subtle. And it's usually families look back and say, you know what?
That's right.
Looking back, I noticed there's been a change over the last 3 or 4 years.
What sort of personality change are you talking about?
Becoming more rigid, more inflexible, more intolerant,
angry,
more irritable, angry. Exactly.
Angry,
but not always. Some people, we have a very good friend who actually went through a total personality change from somebody who was very antisocial to somebody who suddenly became extremely social.
Disinhibited.
Very disinhibited.
different.
Yes, very different.
My dad had vascular dementia, which is the second most common after Alzheimer's, and he just rang one day and said, Ida? And I said, yes. He said, I can't find my pyjamas. And I said, where are you? And he said, Burke, as if I was a half-wit for asking. And I said, what are you doing in Burke, Dad? He said, I'm attending a conference, and hung up. And, you know, I knew at once there was something wrong.
Yeah.
Was he in Burke?
No, of course not. He was in the kitchen in his home at Linfield having a cup of tea, and he was wearing his pyjamas.
Let me ask you on that example then, what did you do at that point?
Well, he'd rung one of my brothers as well, so we both rushed to Dad's place, didn't we, to find out what was what. And of course, when we talked with him, we could see that all was not well.
So when the person involved or their family realise something's not right here, what do? You go to the GP?
Yeah, you go to the GP.
And how good are GPs at diagnosing this?
It's a hard diagnosis, isn't it, Henry? That's why it takes 2 or 3 years to diagnose it. But with Dad, I think it was pretty apparent that there was clearly something wrong. And his GP said to me, look, you just have to think if your father is short-circuiting. Every now and again he's had a short circuit. And that's exactly what it was. Sometimes he seemed perfectly lucid and other times he clearly wasn't.
And sometimes people say, oh, look, you're just getting old. You know, this is just something that happens with old age, but it's not true.
No.
That's not good enough, is it?
It's not a normal part of ageing. That's one of the myths we want to put to bed. Dementia is not a normal part of aging.
I read a very disturbing statistic, and it may be wrong, but tell me, 90% remain undiagnosed? Is it that high?
It's about 50%. 90% is the upper figure of the studies. So there have been a number of studies.
But even 50% is an alarming number.
50% of mild dementia is undiagnosed. When it's more severe, I mean, you see somebody who can't remember what they did 5 minutes ago, you don't need a doctor to diagnose it. The challenge is when it's milder in the earlier stages.
So how do you actually nail it down? What sort of tests are done?
Well, most of the diagnosis is made on the history, particularly the history from someone who lives with the person. There's nothing like living with a person 24/7 to realise what problems they're having.
So it's not so much testing what's going on in there?
We do all of that too, yeah.
Right.
So we'll take the history from the patient, we'll take the history from the family separately. We'll do some tests to look for reversible causes, because occasionally we find, you know, there's a thyroid deficiency or a vitamin deficiency or a tumour we can treat. Mostly we don't. Almost never do we find that. Then we might do a scan to see if there's any changes in the brain. Usually we see shrinkage of the brain, or in the case of Ida's father, we might see the vascular changes, particularly with an MRI scan. And pretty well 95% plus of the diagnosis we can make at that stage.
Obviously cases vary markedly, but what's the sort of prognosis?
Depends on the age.
Right.
We generally say it's 10 years from onset to death. But if you're 40, or in Ron's wife's case, she was in her mid-40s, diagnosed in her mid-50s and died, how old, Ron?
61.
So that was 15 years, yeah. If you're 90 when you get diagnosed, you're not going to live 10 years anyway, even without dementia. So the amount of life that's lost is much less. But if you're 40 or 60 and you only got 10 years of life, that's quite a tragedy.
So How important is that early diagnosis?
Well, it's really important. There's so much you can do. Certainly there are drugs for the treatment of Alzheimer's disease which are symptomatic. They don't cure the disease, they just slow the symptoms a little bit. Okay? So modest effects. But there are things like making life decisions, getting your legal affairs in order, making financial decisions, arranging legal things like enduring power of attorney, enduring guardianship, attending to driving, people are still working. The family and the person understanding what's happening, they can sort of make sense of their world. But because a person has dementia, as they say, it's a word, it's not a sentence.
That's right.
People
One
can
of
have
the
a
things
positive
we're
quality of life.
campaigning, one of the things we're working towards with Alzheimer's Australia is to improve the diagnosis. We think, we think that GPs need better training, and they probably need more support. We're thinking that perhaps they need some clinical nurses to assist them, because it is a difficult diagnosis.
Yeah.
And often the doctor is a family friend and doesn't want to make the diagnosis.
Well, doesn't want to actually say...
because it's it's a hard thing for people to come to grips with at the best of times.
You can't cure it. You can depress the person.
But David, I'd also sort of say that whilst we're talking about the incidence of dementia and saying that 1 in 20 over 65 have dementia and 1 or 3 or 4 over 85,
Yeah.
we can look at it the other way. Otherwise, all of our viewers will think that everyone's going to get dementia.
Yeah.
2 out of 3 people will never have dementia.
That's right.
Pretty good odds.
Yeah.
But that's not to mitigate the how important it is as a health issue for Australia.
You were also telling me before we came on air there's an app.
There is.
Alzheimer's.
Alzheimer's Australia has a Brainy app.
Brainy app. It's been very successful.
It's called Brainy app.
You can test your brain. You can play games with it, all sorts of things.
Well, that'll give you a bit of an idea as to...
Oh, well, it's just a test.
Whether
It'll
you're
tell you things to do, things to eat, lifestyle, being physically active, being mentally active, all those sorts of things.
All right, once someone is diagnosed, Ron, what happens then? I mean, how much support do you get?
Well, when we got diagnosed, when my wife got diagnosed, we got no support. We were too young. There was no support at all.
So it's like this is the diagnosis.
Yes.
See you later.
See you later. In fact, the neurologist who did it, his words were, "Go home, get on with your life. I see people with worse issues every day," which was pretty terrible.
How did you cope with that?
We really struggled. I had heard vaguely about the Alzheimer's Association at that time, and I called the local association and spoke to a counsellor, and that was very helpful. It really gave me some places to go, things to do. My wife was still quite functional. She's still driving at this stage. And so now we had a diagnosis. Now we had to make some decisions about what we were going to do. And I had to make some decisions about work. I gave up work for a year. We needed to do some things that we still had time to do before she started to lose capacity and enjoy those things that we needed to do.
Did you start any treatment at that early stage?
She actually went on one of the early trials for the drug called Aricept, which didn't do her, and it didn't help her in her particular case. I was not able to in any way detect any change in the decline over time, which I think...
Have things changed since then?
Yes.
I mean, do people now get more when at the point of diagnosis?
Well, there's the point of diagnosis. Well, I keep running into people who have no idea where to go to get counselling. I do run, and I say to them, ring us up. We've got
so what do they get if they ring you up?
They'll get a counsellor who will start talking to them about the issues you're going to face, where you can get help, what support, what you should be doing, all those sorts of things. And I think from the perspective of getting some care for the person with the dementia, that's important, but also the carer needs to get some help.
That's what I was going to ask.
Yeah, and so for the carer, it's very supportive, what to look out for, what to expect. I remember speaking to somebody at a television station whose mother had dementia and he just didn't know. He didn't know what to expect. And I said, well, look, ring us up and we can help you.
So what should a carer expect? Whether it's a husband, wife, a son, a daughter... What should they expect?
It's a hard call. It's very difficult to watch someone you love change, and it's very difficult to accept the feelings that they have. I remember hearing someone with dementia say that she felt worthless as a person and diminished in the eyes of her children. And you think that's a terrible thing to live with. And the carer often needs to have some respite care, but doesn't take it because they think they'll be letting down the person that they love.
I'm guessing there's a period of depression that would often go along with...
My father often told me he felt depressed. And it's a terrible thing because there's nothing you can do.
I think, Dave, you're referring to the carer as well, aren't you?
Yeah.
I think both ways.
And often the impact can be greater for the carer than for the person.
They often say, yeah, that he has Alzheimer's, but they all suffer with it. Talking about the family carers.
But it's not always like that. I know for quite a long time I was able to get my wife engaged in various things I was doing. I'm a rabbit researcher professionally, and so I started taking my wife out into the field, handling rabbits and doing all sorts. And for her, that was quality time, and that's the opportunity that you can still have if you get an early diagnosis. You can do those things that you might have put off until a later time.
And even if you have dementia, it's important to do things like that. It's important, if music was an important part of a person's life, it's important that music should still be in that life, you know, because sometimes they remember how to play the piano.
Oh, yes.
Well, I want to explore what you can do, what helps, what doesn't help, when we look at caring for people with dementia and their families and carers as well. We'll take a quick break. Stay with us.